The 3M V.A.C Veraflo Cleanse Dressing is specifically designed for use with 3M Veraflo Therapy. The foam is less hydrophobic than other V.A.C therapy dressings, which helps facilitate even distribution of topical wound solutions. V.A.C Veraflo Cleanse Dressing is provided in a pre-cut tubular configuration that can be split and/or cut to best conform to the geometry of the wound. The foam has increased tensile strength and may be used in wounds with complex geometries and in wounds with explored tunnels or undermining where the distal aspect is not visible. The V.A.C Veraflo Cleanse Dressing Kit contains the V.A.C Veraflo Cleanse Dressing Foam, 3M Cavalon No Sting Barrier Film, a 3M V.A.C Ruler, 3M V.A.C Advanced Drape, and the 3M V.A.C Veritrack Pad, an all-in-one system that incorporates tubing for fluid input and tubing for exudate and fluid removal through a single pad interface. In addition, these accessories are available separately: the 3M V.A.C Veritrack Duo Tube Set, the 3M V.A.C Verilink Cassette, the 1000 ml canister, and the 500 ml canister. Before applying a new dressing, remove and discard the previous dressing per institution protocol. Thoroughly inspect the wound to ensure all pieces of dressing components have been removed. Ensure debridement of all necrotic, non-viable tissue, including bone, eschar, or hardened slough, as prescribed by the physician. Perform a thorough wound and peri-wound area cleaning per physician order or institution protocol prior to each dressing application. Protect fragile or friable peri-wound skin with medical-grade transparent film, skin protectant, or hydrocolloid. Make sure the skin is clean and thoroughly dry prior to applying the Cavalon No Sting Barrier Film. Use the wipe to apply a uniform coating of film over the desired area. Allow to dry thoroughly before applying the drape. Ensure adequate hemostasis has been achieved. Assess wound dimensions and pathology, including the presence of undermining or tunnels. Do not place any foam dressing into blind or unexplored tunnels. A non-adherent material can be used prior to foam dressing placement in order to protect delicate structures, such as blood vessels, or to facilitate future dressing removal. Protect fragile or friable peri-wound skin with medical-grade transparent film, skin protectant, or hydrocolloid. Carefully tear the V.A.C Veraflo Cleanse Dressing along the perforations to separate the dressing into two halves. The foam may be applied in the full tube, half tube, or custom cut configuration. Gently place the foam into the wound cavity, covering the entire wound base and sides, tunnels, and undermined areas. Cut and remove any excess length of unused foam away from the wound. Trim the V.A.C Advanced Drape to cover the foam and an additional 3 to 5 cm border of intact peri-wound tissue. The V.A.C Advanced Drape may be cut into multiple pieces for easier handling. Carefully remove layer 1 to expose the adhesive. Hold the drape with the ruler handling bars. Place the adhesive face down over the foam and apply the drape to cover the foam and intact skin, ensuring at least a 3 to 5 cm border of intact peri-wound tissue. Remove layer 2 and pat the drape to ensure an occlusive seal. Remove the ruler handling bars. Choose an appropriate location for the V.A.C Veritrack Pad. Pinch the V.A.C Advanced Drape and carefully cut a 2.5 cm hole, not a slit, through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. Next, remove both backing layers 1 and 2 from the pad to expose the adhesive. Place the pad opening directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. You are now ready to connect the V.A.C Veraflo Cleanse Dressing to the V.A.C Therapy system. Please watch the V.A.C Therapy system video for further instructions on initiating Veraflo Therapy. Remember, dressings should be changed every 48 to 72 hours, but no less than 3 times per week, or as ordered by the clinician. For more product demos and application techniques, visit 3m.com/medical.